नमस्कार. I am grateful to the Medical Education Cell of Indian Academy of Pediatrics for creating this opportunity for me to address this August gathering. Today we are going to discuss about faculty development, something which is very crucial with the current curricular changes which have been going on, but which has a lot of lacunae and other issues which often we do not address. We generally see faculty development only as a training. But as we will discuss today, faculty development is not just a training, it is much more than a training. In fact, coming from a country where a teacher is placed at a higher pedestal as compared to God, it becomes imperative that teachers discharge their duties and responsibilities in a way that they can result in maximal learning, and the students, when they go out, are able to use their learning for the benefit of the society. As we look at the changing trends in education, which have been happening for the last many years, one of the major things that you see is that the emphasis is shifting from reproduction of knowledge to application of knowledge. So you're no longer interested in a student being able to tell five causes of A and 10 causes of B. That is not really the thing. What we want to know really is that is the student able to help a patient who presents with a certain complaint. Competency-based curricula are a new entrant rather in the scenario, and they become important because incidentally, none of us, neither the students nor the teachers nor the administrators, had any exposure to being taught by the competency-based model. We all have been taught by conventional models. And suddenly when competency-based curricula comes, it creates a kind of gap between what we know, what we believe, and what we are supposed to know and what we are supposed to. There are accreditation requirements which need teachers to behave in certain ways, and a shift from criterion to norm referencing. In fact, with the competitive exams coming and with the fierce competition going on for a small and smaller number of seats and admission compared to the total number of students which are available to compete for such, the focus has actually shifted from criterion referencing to norm referencing. And that creates a lot of problems for us as far as learning is concerned. Simultaneously, if we look at the medical practice, we can also notice many changes in medical practice. For example, medical colleges turning into big and bigger ICUs, treating very rare cases. I remember when I was doing a post graduation, we had a separate neonatal tetanus ward, we had a separate measles ward, we had a separate isolation ward with a lot of diphtheria cases. And at any given point of time, it was not unusual to find five cases of tetanus and four cases of measles with all kind of complications and clinical pictures. I don't think the students these days ever get to see those cases. Similarly, in medical disciplines or surgical disciplines, things like hernia or hydrocele are almost going away. Patients come to a medical college only when they have been treated outside for a number of days. And the primary care physician actually is becoming almost extinct, partly because the society demands specialization and super specialization, and partly because we have not been able to create a career pathway for primary care physicians. So everybody is after a specialist degree. Nobody wants to pursue career in primary care. Changing educational trends is another important aspect which actually requires faculty development. Let's look at some of the issues. High cost of education. When I was a MBBS student, I used to pay only 125 rupees a year. Yes, you heard it right, 125 rupees a year. And I used to get 100 rupees a month as scholarship. Now 50 to 60 lakhs is the minimum. in any private medical college. Not only the cost has gone high, but the commercialization of education has also become a norm. We all are aware of what is happening with various competitive examinations these days. And as a result, the students have actually changed their attitude from being a shiksharthi, somebody who has come to acquire education, somebody who has come to acquire the concepts, to pariksharthi. Everything is examinations. You try teaching them communication, at the back of their mind, they have the same question. Is it going to help us get more marks in entrance examination? You try teaching them the problem-based way, they'll ask the same questions. Will it help us in getting more marks in the competitive examination? So everything revolves around examinations. And then plenty of rules and regulations and judiciary. I have never seen so many court cases happening in educational domain as I saw in last, say, about 10 to 15 years. And all these things actually demand that the teachers are prepared for the changing societal expectations, from the changing educational expectations, and from the general change in education, which we have been witnessing so far. I could not have found a better example than to share with you the meta-analysis done by Haiti and L in 2000. Now, they included 14,000 studies in their meta-analysis. It was a massive data from almost all countries across the globe to find out what factors influence achievement. And these are the factors which actually stand out as having an influence on achievement. And interestingly, if you see here, for most of the factors are under control of the teacher. So giving feedback, the quality of instruction, remediation and feedback, classroom environment, challenging educational goals, and so on. And on its own, the effect sizes are very strong. 1.13 and 1.04 indicate a very strong effect size of this intervention. So what it implies is that preparing the teachers for these activities which contribute significantly to student achievement is crucial. And in this context, if we look at what is faculty development, there are multiple definitions. If you search the literature, 30, 40 definitions are available. But I particularly like the one by Steiner because she is the one of the most respected authorities in the field of faculty development. And what she says that it's a process by which medical school faculty work systematically to improve their skills in teaching, instructional design, scholarship, personal development, and implementing a professional development plan. If we read this definition again, there are a lot of important words, and I just highlighted them. That it's a systematic process. So it's not that you just organize a training in your department and say that we have done faculty development. So it's systematically organized where you focus on not only the skills of teaching, but also the instructional design, scholarship, and personal development, and then implementing a professional development plan for the teachers themselves. Now, when we design a faculty development module, then you have to keep all these factors into mind. That is not just giving them a, in fact, that's very interesting. The moment we talk of faculty development in medical education, everybody just thinks of teaching activities. That's the first thing that comes to your mind. How to give a lecture, how to make slides, how to take practical exams, how to conduct an OSCE, and so on. So for us, faculty development actually is only improvement in teaching qualities, but in fact, it is not. And if you look at this definition, then it goes far beyond than what we conventionally think about faculty development. Interestingly, I came across this paper many years ago, and it's published in the year 2000. It says faculty development, teacher training, and teacher accreditation in medical education 20 years from now. And interestingly, we have actually crossed that point. So in 2020, what he had predicted would happen, and we are already in 2024. So let's see what Benor says. And Benor predicted that a future medical teacher will provide learning opportunities. He will direct the students to appropriate resources. He'll conduct distance, online, and self-directed learning. He will guide the students through emotional labyrinth. He will be an effective, valued professional in his own field. He will assess the performance of student and guide him for further learning. How interesting and how surprising it is that this man could predict a quarter of a century ago as to what we are going to do today. In fact, most of the things that he had predicted, and COVID provided an opportunity to get into distance and online mode. The self-directed learning is a part and parcel of the new curriculum, providing various learning opportunities in the form of lifelong learning is already being emphasized in the new curriculum. So what you notice is that over the years, the emphasis is not changed. Even if there was no COVID, for example, the time had come when probably we would have had to shift to distance learning and online learning. And the importance of self-directed learning and finding appropriate learning opportunities in your day-to-day work can never be overemphasized. Take another example. I'm sure most of you have seen this, The 12 Rules of a Teacher by Harden and Crosby. And again, interestingly, in 2000, almost quarter of a century ago. And if you look at these 12 rules, what's interesting is that many of the times, most of us still get stuck to the role of an information provider. Many of us believe, including me, that if we do not tell the student, they will not. We forget that they have better sources of information available these days. Sitting in their hostel rooms, they can fish out more recent, more latest information contrasted to what we can provide them in the classroom. Assessor. In fact, the prime factor for the success of competency-based education is assessment. So if a teacher is not good assessor, and when I say assessor, it's not just writing MCQs or creating OSCE stations, but an assessment of performance, assessment of competencies, assessment of soft learning areas like professionalism, communication, ethics, critical thinking, research abilities are some things which are desperately required. Teacher has to be a role model. When we say professionalism, a lot depends on being the right role model. A lot depends on being the right person whom the students can emulate. Facilitator. All the self-directed learning, all the student-centered learning, problem-based learning, case-based learning, actually everything depends on the facilitator role of the teacher. Resource developer. You may need to develop modules for skill training. You may need to develop modules for, like, for example, we have done for EdCom and many other aspects which are conventionally not covered in the textbooks. And the resources for these have to be developed. Planning, the curriculum delivery, the assessment, remediation are all important activities which require planner role of the teacher. Now, often it is said that I am so senior. Why you need to teach me how to take a lecture? I remember my first teacher training workshop, which I conducted, and I was only an assistant professor at that point of time. And in the audience, there were very senior professors, some of them retired professors, some of them ex-army gentlemen. And one particular teacher of biochemistry, who was a retired brigadier, at the end of it got up and said, "ये कल का छोकरा हमको क्या पढ़ाएगा?" Probably if I was to be told by somebody today that we are going to teach you different teaching method, my reaction would not be very different from what he had said. But if you look at some of the qualities of good teachers, or rather, I should say, some of the things in good teaching practices, then these are the things which would happen. For example, deep representation, problem solving, classroom climate, sensitivity to the context, feedback, passion, and set challenging tasks. Now, if you compare the expert and experienced, and again, it comes out of the meta analysis done by Hetty in 2000. So, what actually comes out is that experts score better on all the parameters contrasted to experienced teachers. Now, I don't want to get into that debate of senior and junior or experience or non-experienced, but let's make it clear that knowing about something and doing it is much better than simply keep on repeatedly doing an act. So expert teachers would perform better than experienced teacher in most of the classroom parameters. If we look at the Indian scenario, then faculty development actually started with national teacher training centers in India. Five of them were established in Chandigarh, Maulana Azad, Varanasi, Zipmer, one more I'm forgetting. So five NTTCs were started, and these were actually followed by medical education units. The 1997 regulations made a mention that every college should preferably have a medical education unit. Of course, the 2019 regulations have made it compulsory, but before that, few colleges used to have, others didn't have. And then came the FEMA regional institutes in the year 2006. Around same time, in preparation for a curriculum change, the Medical Council of India got involved in faculty development and started conducting under its own banner the basic course. Later in 2014, we started with advanced course, and being involved with almost every of these activities, I can tell you that there has been a change in the way we train the participants of these workshops. In fact, with changing emphasis, what we teach and how we teach the participants has actually changed. When PBL was the technique of the day, now that was the time when most of the training used to be focusing on PBL. When OSCE was introduced, every workshop, would have a large chunk devoted to OSCE. And now with CBME coming in, for example, since 2019, we have not talked of anything except CBME. So with changing emphasis on the educational scenario, the faculty development has also undergone a significant change. Interestingly, if you look at the earlier concept, then good teaching was considered synonymous with good delivery. If you crack a good joke, if you make the students laugh, you have very good PowerPoints with a lot of animations, etc., etc., you were considered a very good teacher. And it was believed that teaching skills are standardized and therefore they must be learned exactly the same way by everybody. So there was no difference in the individual teachers. Every teacher was supposed to learn the skills the same way. And more importantly, it was also believed that criticism and feedback of the teachers will help in improving the teaching skills. Now, so much so that an important technique like micro teaching, which had the potential to improve the quality of teaching, actually came to be labeled as putting the teacher under microscope and looking for his faults. It's fortunate that this didn't last long and we didn't really pursue with this interpretation of micro teaching. But that's what it was. The subsequent years actually saw a change in our understanding. So good teaching is no longer considered as synonymous with good delivery. Good teaching is considered synonymous with good learning. And that is where all the difference comes. Now, when you look at the outcomes of faculty development, what's interesting is that the outcomes are not immediate. It's not that you train somebody today and tomorrow he'll become a good teacher. They are not well defined. We don't know what a good teacher would look like in the classroom, and they are really difficult to measure. Research has shown that faculty development changes the way a teacher conceptualizes and promotes learning. Now, this is something which is not really visible to the naked eye. It has to be interpreted from various factors. It has also been found that the teachers who are trained have shifted from simple transmission of knowledge to connectionist approaches. That means what we talk of integration now is actually connecting one fact with another and making sense of it. And lastly, it also helps in intra and interpersonal development. So when you have faculty development, it's not just me who benefits, but it's also my colleagues in the department. There is some diffusion of what I have learned, and it helps to create intrapersonal development as well, in addition to interpersonal development. Now, often training is used as one of the means for faculty development. For years, it has been used. In fact, since 1970 onwards, I can say we have been using training for faculty development. It's an investment in future. But somehow, medical schools are reluctant to send teachers for such training. Now, of course, they are, under instructions forced to send teachers. But I'm talking, say, 50 years ago, when you would not get teachers for faculty development programs. I and Piyush conducted one faculty development program as part of IAP pre-conference workshop, and we had only just two participants in the national conference of IAP. When the institutions send their teachers for faculty development, they always send with some expectations like that your pass percentage will go up, the students will score more marks, they'll get distinctions, and the teachers will get best teacher awards and so on. I myself had to hear this so many times. You are doing faculty development for 30 years now. You have never been selected a best teacher. Well, I generally don't respond to this question. But then that was the expectation that if you come back from a teacher training program, you will become the best teacher and you must get a best teacher award, which unfortunately never happened for most of the people. Now, what training paradigm says is that people are classifiable into untrained and trained. So, a group of teachers in your department are untrained, a group of teachers are trained. And once they attend a training program, the label changes. So, the untrained also become trained, and then you don't have to do anything else. All that you need to do is just impart one training. Now, it's simple for everybody because training can be imparted in a limited time and to large number of people. One training workshop, for example, you can have 30, 35 people sitting there. You have an online training program. You can have 200, 300 people sitting there. So, in one shot, you can change the status of 200 people from untrained to trained. And therefore, what institutions believed that their responsibility is only to provide or arrange training. So they'll give you money for organizing a workshop. They'll help you in identifying some experts from other institutions. They'll probably give holiday to the teachers from their departmental activities. So that's all that the institutions had to do. It's been in vogue for many years. I've written here 30, but I'm sure more than 30 years, the training has been going on. And most of the times, when we do a kind of program evaluation of training, teachers training, then we either look at satisfaction or we look at short-term gains of knowledge. And it's very interesting, one small bar and suddenly, we have a very high bar and we are so happy. Wow, they learned everything. Satisfaction, of course, yes, food was good, ambience was good. I was away from department. I didn't have any night calls to do. So everybody is satisfied. But if you look at change as a result of this training, that was hardly visible. I had this question posed to me by Dr. Arun Jamkar, who was Vice Chancellor of Maharashtra University of Health Sciences at that particular period of time. And he asked me, Tejendra, you tell me, you have been teaching, creating good questions and question papers for so many years now. You believe that the quality of question papers which are given to the student these days has changed? He was right. They have not. And we still keep on investing more and more in training. So, in that way, training becomes the educational equivalent of junk food. You are put on a rocking chair, you keep on rocking. We are happy we have regular training, and then we can say more than 95% of faculty is trained here, and there is a significant difference in the pre and post test results. But have we advanced? That is the question which nobody seems to be asking or seems to be interested. Now, training in it itself is not enough. Training has to be applied at the workplace. You go to another institution, learn about OSCE, you have to come back and set up OSCE in your institution. Then only training is useful. So, bringing the new concepts from the training classroom to your actual workplace is what is called transfer of training. And before you get any guilt feelings, transfer of training universally is less than 10%. Very few people and very few concepts which are learned in the training are actually brought into the classroom. And no wonder that transfer remains a major issue in training literature. You pick up any journal on training and development, pick up any journal on medical education. The concern everywhere is that we are training, but are teachers taking it back to the classroom where they actually need to apply? And the high costs incurred with training are justified only when the teachers are able to bring it back and apply to their day-to-day work. I'll give you an example. You have a saucepan, fill it with milk, put it on gas. The expectation is that the saucepan will get heated It will transmit the heat to the milk, which will boil. And so some purpose will be served. But imagine a situation where you put the saucepan on the gas, the saucepan gets hot and hotter, but doesn't transmit that heat to the milk. It's just something similar which happens in training. Contrasted to training paradigm is the development paradigm. And development paradigm requires unlearning old practices, which is probably one of the most difficult things to do. You have to unlearn the old practices and build connections between what is known and what has been told to you in your training. And please remember that these new behaviors require practice and reinforcement. You learn how to give feedback. It's not that immediately you will come back and start giving good feedback to your students. You require practice. You learn about OMP. It's not that you come back and immediately you will become an expert OMP facilitator. It requires a lot of practice and reinforcement to not only acquire the new behavior, but also to put that new behavior into practice. And what is more important is that these changes are generally implicit. They happen within the individual. They're not overtly visible. It's not that you go to two different classrooms and peep inside and you say, oh, this is trained teacher. Oh, this is not a trained teacher. That doesn't happen. So development paradigm is always time consuming and requires a lot more effort and activity as compared to only training paradigm. Equally concerning is that in development paradigm, there is something which is called relapse. Just like medical illnesses, you can have a relapse and enteric fever. Same way, you can have a relapse with training. You go to a training, new training, learn a lot of things about how to use online teaching, come back home. It's not really that simple to practice as US thought. You do it for some time, then you say, oh, my old way was better, you revert it back. That's where the relapses happen. All your training has gone waste. And therefore, the organization's responsibility, remember what we said in training, it is to arrange and provide training. In development paradigm, the organization's responsibility is not only to provide training, but also to provide a culture where such training can be used. When I had gone for my educational training with Indira Gandhi National Open University, this was somewhere in early 90s, and they were teaching us use of audio-visual aids. Now, that time, the only aid we had was a overhead projector. And most of my co-colleagues who were there in the training part, of course, they were not from medical schools, they were from other colleges. And most of them had only this, and we don't have either OHP in our college, or the college doesn't allow us to use OHP. It's only for very senior people. So now, if even if you train them for using OHP and you don't provide an opportunity to let them work on an OHP, this training and development is probably not going to succeed. So what has to happen is that before a person is sent for training, supervisor support is necessary. If your head of unit or head of department is not happy with you going for a training, unlikely that he or she will let you apply many of these concepts when you come back. So the person who is going for training has to be told about what the training is about. He or she has to set up training goals. Okay, I'm going there. I will learn how to create OSCE stations. I'll learn how to design a checklist. I will learn how to implement it in our setting. I will learn how to explain it to the students about the new teaching methodology, assessment methodology, and so on. And there has to be some kind of a post-training assessment. And when I say post-training assessment, is not just giving the same questionnaire before and same questionnaires after. That's not the kind of assessment we do. And this assessment should actually be used to define the needs of the subsequent training whom we are going to send for training. During training, adult learning oriented design are what are required. Simply having a series of PowerPoint slides and just talking non-stop for 9 to 6 is not really going to help. You have to provide them opportunity to assimilate the material. You have to provide them opportunity to look at the material very critically. Where does it fit in your current situation? And engaging the trainees in various problem solving activities, allowing them to reflect how you are going to use it, what problems you anticipate, how you are going to solve these problems, providing them feedback, and most importantly, keeping training as close to work environment as possible. I take the same example of an audiovisual aid. Now that many institutions have smart boards, but suppose there were no smart boards in the institution and you provide a training on smart boards, probably it's going to go waste. It doesn't help. Now, please remember that role of the trainer ends here. You can select people whom you want to train. You can select the training methodology. You can select how you are going to train them. But after that, your role ends. And after training, in fact, it is the role of the institution, the organization, which becomes more important. They need to be provided support. I'm sure many of you have heard this. I have heard it many times in my institution when my boss will say, "हाँ जी, छुट्टी मनाए हो ना 5 दिन की, चलो अब काम पे लग जाओ." You have killed the whole thing. Post-training discussions. Have we ever sat with our juniors who have gone for training to talk to them? Okay, tell me what did you learn? Tell me how you are going to apply it here. Tell me what problems you anticipate. We never do that. Have we looked at the facilities? We are talking of audiovisual aids. We are talking of uh, various computer-assisted techniques to learn. But do we have the facilities available? We never think about that. We have to allow innovations, which may be not the currently accepted practices. Sometimes retraining might be required, and more importantly, relapse prevention. Because second to lack of transfer of training, relapse is one of the major issues which actually negates a lot of our faculty development effects. I'll give you an example. Uh, let's be clear on this that it's not a study which was designed to measure the effectiveness of CISP. So what we did is we did a multi-centric study about 15 medical colleges in the country, and we assessed their stages of concern. We don't have time to go into these details, but you could Google possibly, and you could actually download our paper to read more about this. What you find is that whether they attended CISP or they didn't attend CISP, there was actually no difference. There is some change over here. And if you look at this profile in terms of stages of concern, this profile will be typically classified as interested but non-user. So maybe we have been able to generate their interest. Maybe we have been able to provide them some theoretical background. But has it resulted in them applying these practices actually in their teaching, in their classrooms? No. Not only CISP, we actually compared with people who had done FAMER and ACME. And again, you find almost a similar kind of pattern. So it's not to say that CISP or FAMER or ACME were not useful. They had a different purpose, they had a different objectives. But when it comes to applying the concepts of competency-based curricula, then probably they are still non-users. Please remember that this was published in 2022. This was carried out in maybe 20, 20 or 2021. So maybe things have changed now. But if you look at that, training alone would not be able to really implement the transfer. And unless the training is transferred, will not be able to make use of that training. Another study which we did was on female fellows. And what we found is that intention to transfer, that's interesting, that after the training, do they plan to change something? And what are the factors which actually help them to decide whether they should transfer the training to their workplace or continue with status quo? The first, the subjective norm at the lowest influence, 0.07. And what it means that regulatory requirements are probably not enough for people to go and apply the training back to their work. To say FCI wants this or NMC wants this or university wants it, probably is not going to cut much out people. The second was perceived behavior control. How much I know I can do it. You may teach me about AI. I listen to it, but I don't feel comfortable in using that concept in my work back. So I won't apply it. So perceived control over behavior contributed 0.21. And this is how confident I am that I can use this innovation back home. And the most important contribution was the attitude towards behavior. How much, in my opinion, the innovation will impact learning. And that suggests that rather than only making a regulatory requirement for training, what is more important is to actually change the attitude of people towards that behavior. If I use reflections, it's really going to help the students. Therefore, I should use it. Contrast it with you must get the students to write reflection. Okay, I'll ask them to write reflection. That's it. Now, that is where the crucial difference lies. And all training actually should have a lot of opportunities for the people to clarify their issues, to bring out their hidden concerns, to bring out the fears and aspirations that they have, and then to get it clarified so that what can they actually do to apply the new concepts in their classroom. Being a pediatrician, it's interesting to compare faculty development with immunization. Just like immunization, faculty development is useful for a specific purpose. You cannot teach about PBL and hope that they will learn about CBME also and vice versa. It requires time to produce effects. Training them today doesn't mean tomorrow they are going to apply all these concepts. Adjuvants can enhance effects. So you give them success stories, you give them practical examples, you give them certain demonstrations, which is likely to enhance the effects of training. But it can also be retarded by various interfering factors. No, my university doesn't allow this, so I cannot ask them to do this particular. Very commonly we see it here. Then contextual factors. And in fact, this is important because they provide us the best time to get into training. If CBME has been introduced, then probably this is the best time to train people about CBME. If you start teaching them about PBL at this period of time, most of them will not really pay any attention to it. The effects wane over time, just like vaccines. And you require booster shots. That is what we do for immunization. That's what we have to do for faculty development. I want to share with you a meta-analysis published in Academic Medicine in 2008. And this group, Sutkin et al., they reviewed more than 1,500 publications to find out as to what the students are looking for in a good medical teacher. And this is the list that they came out with: medical clinical knowledge, clinical competence, clinical reasoning. It's almost the three things said in a different way. Then positive relationship with students, communication skills, and enthusiasm with teacher for teaching. And what I want to emphasize here is that medical or clinical knowledge is one of the foremost things required to become a good teacher. No amount of PowerPoints, no amount of animations, no amount of videos, no amounts of smart talk in the classroom can compensate for lack or poor medical or critical knowledge. So when we think of faculty development, don't just think of teaching. Think of enhancing the knowledge. Think of enhancing the clinical competence and clinical reasoning of the teacher, because that is what the students look for in their teachers. Abraham Lincoln very rightly said this, that if you have given me 6 hours to chop a tree, then I'll spend the first 4 hours sharpening the axe. And I think this is what faculty development should be all about. A good proportion of a teacher's time should be spent in faculty development. It may not be in the classrooms always. It can be a self-development. It can be in your own institutions without going out anywhere. It can be over the internet or online or distance learning. But what is more important is that a good proportion of your time should be spent in sharpening your axe. Thank you very much for listening, and I'll be happy to answer any questions that you have.